I'm Casey. I'm going to be the nurse practitioner student doing your health history today. So, what brings you in today?
I've had really bad allergies over the course of the last week.
All right. Any secondary fears or concerns of what brought you in or what really kind of triggered you to come in today?
No, ma'am.
Okay. And how long has this been going on for?
About a week.
All right. What symptoms have you been experiencing?
Runny nose, congestion, and a lot of drainage towards the back of my throat.
Okay. And what symptoms started first?
I noticed the runny nose first.
Anything that seems to trigger these allergies?
They're just tends to get bad around oak and cedar whenever the oak and cedar count is high.
Any symptoms get better or worse throughout the day?
I've noticed that the irritation that the drainage in the back of my throat causes, that tends to go away as the morning goes on.
Okay. Have you been taking anything to help with?
I've been using Zyrtec for the last week and it hasn't really been doing anything for me.
All right. Any complementary or alternative therapies you've been trying, such as neti pot?
No, ma'am.
Okay. And how was your health prior to getting ill?
It was great. No complaints.
Okay. We're going to move on to your past medical history now.
Okay.
Have you ever been hospitalized?
No, ma'am.
Any childhood illnesses?
Not that I can recall.
Any adulthood illnesses?
No, ma'am.
Have you been seriously injured in the past?
No, ma'am.
How are you on your immunizations? Are you up to date?
Yes, ma'am.
Okay, when's the last time you got a TB exam?
It was about a year and a half ago.
Okay. And are you allergic to anything?
Um, I'm the oak and the cedar, and not to any medications though that I know of.
Okay. Do you take any medications on a daily basis?
Multivitamin.
All right. Now we're going to move on to your family history.
Okay.
I want you to tell me about your generation up to your grandparents, so 3 generations. If anyone's had any hereditary diseases, if anyone's passed away, any pertinent medical information.
Okay. I have an older brother. He's about 3 years older than I am. As far as I know, he hasn't had any medical complications. My mom, who is 61, she had a benign growth removed from her breast.
Mm-hmm.
My father was epileptic. He was born with epilepsy, and he passed away in his late 50s from aspiration pneumonia.
Okay.
Both of his parents, my paternal grandparents, they were both multiple pack-a-day smokers, and both passed away from lung cancer because of it. My grandfather, also in his mid to late 50s, like my father, and my grandmother passed away in her mid to late 70s.
Okay. And what about your mom's parents?
My grandfather on my mom's side, he passed away in his mid to late 80s. He had Alzheimer's the last few years of his life, but it was eventually sepsis that he passed away from. And my grandmother on my mom's side, she's 88. She's still alive, but a few years ago she was diagnosed with colon cancer, and so she had to have surgery to have that removed.
All right. Do you have a significant other or any children?
Excuse me. I have a wife. She, as far as I know, she's healthy as well. No children.
Okay. And how long have you two been married?
Married 6 years.
Okay, we're moving into the personal and social history now. And tell me about your home environment.
Home environment's great. No complaints.
All right, who's all in the home, including, obviously, hopefully your wife?
Yes, yes.
And any animals?
So yes, my wife and a dog, 2 cats.
All right. And tell me what you do for a living.
I'm a nurse.
All right. And what type of nursing do you do?
I work in the OR as a circulator.
All right. Any risk of being exposed to any chemicals or toxins in the operating room?
We work with X-rays quite a bit, so radiation, I'd say, but I make it a point to wear lead every single time that X-rays are needed for a procedure.
Okay. And we're gonna go. Tell me about some of your health habits. What good habits, such as exercising, do you have?
I try to hike every single weekend.
Okay. And we're gonna kind of talk about health risk factors. Do you use any tobacco products of any kind?
With my paternal grandparents' history, no, I do not. I do not touch tobacco.
Okay. And any recreational or street drug use, such as marijuana or cocaine?
No, ma'am.
All right. How much alcohol do you drink?
It's mostly on weekends. Normally, it's just 2 to 3 glasses, but sometimes more, just depending.
Okay. And how much caffeine do you drink?
Don't drink a lot of caffeine. I just do 1 to 2 cups of decaf in the morning.
All right. Any cultural or religious beliefs we need to be aware
I'm Christian.
of? Okay. Do you use any alternative therapies or contemporary medicine?
No, ma'am.
Right. Talking about, we'll talk about your sexual history. Apologize if this seems a little invasive. Tell me about your sexual history.
My wife is the only person I've been with in the last 10 years.
All right. What type of contraception do y'all use?
My wife is on the pill.
Okay. Now we're going to go into review of systems, and we're just going to kind of break it down. We'll start off with your general constitution. Any fever or malaise?
No, ma'am.
Any night sweats?
No, ma'am.
Do you feel easily fatigued?
No, ma'am.
How's your weight?
Uh, could be better, but I'm currently in the process of trying to lose weight. I've lost about 15 pounds over the course of the last month and a half, I'd say. And I'd like to get down about another 10 pounds. That would put me at 170, which I feel is personally appropriate for my height.
Okay. And how have you been accomplishing that weight loss?
I've been doing keto and intermittent fasting.
All right. Well, we're going to move on to your hair, skin, and nails. And have you noticed any rashes?
No, ma'am.
All right. Any unusual hair or nail growth?
Not that I've noticed.
Any changes in pigmentation or skin
No, ma'am.
and texture?
No, ma'am.
All right. And we'll move on to the head and neck. Any unusual or frequent headaches?
No, ma'am.
Any dizziness or syncope?
No, ma'am.
All right. Any concussions in the past or brain injuries?
No, ma'am.
All right. We'll move on to your eyes. Do you wear glasses or contact lenses?
I do wear contact lenses, and I am currently wearing them.
Okay. How do you feel your contacts are doing?
I feel like they're doing quite well.
Okay. Any blurred vision or double vision?
No, ma'am.
Any pain
No,
in your
ma'am.
eyes? Any sensitivity to light?
No, ma'am. Not that I've noticed.
All right. Do you use any eye drops of any kind? All right. Any past history of eye injuries, traumas, or glaucoma?
No, ma'am.
Any family history of eye disease?
Not that I'm aware of.
Okay. We're going to move on to your ears. Any pain in your ears?
No, ma'am.
Any loss of hearing?
No, ma'am.
Have you noticed any discharge coming from your ears?
I have not noticed any discharge.
All right. Any vertigo or tinnitus?
No, ma'am.
All right, we're going to move on to your nose. Obviously, you said you've got some congestion, runny nose. With that runny nose, tell me about what the discharge is like.
It's kind of clear.
Okay.
It's not really green or anything that I've noticed.
And you said postnasal drainage that kind of alleviates throughout the day.
Throughout the morning, yes, ma'am.
Okay. Any history of nosebleeds?
No, ma'am.
Any sinus pain?
No, ma'am.
All right. How often do you get colds?
I'd say about once every other year.
All right. Have you felt like you've lost any of your sense of smell?
When the congestion gets really bad, I feel like I have a hard time smelling.
Okay. Gonna move on to your mouth and throat. All right. Any tooth abscesses or extractions lately?
No, ma'am.
Any swelling of the gums
No,
or
ma'am.
bleeding of the gums?
Haven't noticed any.
Any hoarseness or change in voice?
In the mornings when the drainage in the back of my throat, That gets better though as the morning goes on.
Any difficulty swallowing?
Again, in the morning a little bit with the drainage, but by the as the morning goes on, I don't have a problem with swallowing.
Okay. Any swelling of the tongue or buccal mucosa?
No, ma'am.
Next, gonna move to your chest and lungs.
Okay.
Any difficulty breathing?
No, ma'am.
Any shortness of breath?
No, ma'am.
Any issues with cyanosis?
No, ma'am.
Any coughing or wheezing?
No, ma'am.
Next, gonna move on to your heart. Any chest pain?
No, ma'am. No chest pain.
Um, how many pillows do you sleep on at night?
2.
Any exercise intolerance?
Not that I've noticed.
Okay. Any history of edema, high blood pressure? Ever had a heart attack?
No, ma'am. Never had a heart attack, and no history of those others.
Any issues with heart palpitations?
No, ma'am.
Gonna kind of ask about your peripheral vascular.
Okay.
Any history of DVTs or PEs?
No, ma'am. No history of DVTs or PEs.
Do you feel like you bleed easily or bruise easily?
I don't feel like I do.
All right, we're gonna move on to hematological.
Okay.
Any issues with anemia?
No, ma'am.
Any history of any bleeding disorders?
No, ma'am.
All right, we're gonna move on to gastrointestinal.
Okay.
How's your appetite been?
Uh, Fair. No changes, I guess I should say.
All right. Any changes in your bowel movements?
Not that I've noticed, no, ma'am.
How often would you say you have a bowel movement?
Every other day,
Okay.
I'd say.
Any issues with flatulence, hemorrhoids?
No, ma'am.
Any issues with nausea, vomiting, constipation, diarrhea?
No, ma'am.
Any issues with heartburn?
No heartburn.
Any abdominal pain?
No, ma'am.
Gonna move on to your diet. You've mentioned that you're on the keto diet.
Yes, ma'am.
All right. Any dietary restrictions besides being low carb?
No, ma'am.
Any dietary likes or dislikes?
I am not a fan of raw tomatoes.
Okay. Gonna move on to your urinary system.
Okay.
Any difficulty urinating?
No, ma'am.
All right. Any pain or frequency in needing to urinate?
Not that I've noticed.
Do you need to get up in the middle of the night to urinate?
If I do, it's only once, but that's like maybe every 30 days or something like that. It's not an every night type thing.
Any flank pain?
No, ma'am.
Any issues with incontinence?
No, ma'am.
All right. Any dribbling or loss of stream during urination?
No, ma'am.
We're going to move on to the endocrine system.
Okay.
Have you noticed any swelling or tenderness in any of the lymph nodes underneath your neck?
No, ma'am.
Have you noticed any swelling in your thyroid or tenderness?
No, ma'am.
Any heat or cold intolerances?
No, not that I've noticed.
Any unusual hair growth?
No, ma'am.
We're going to talk a little bit about puberty.
Okay.
When would you say puberty hit for you, onset?
12, I want to say.
Any issues with your erections?
No, ma'am.
Any issues with your libido?
No, ma'am.
Any issues with infertility?
Like I mentioned, we haven't been trying, so I'm not sure if there are any issues as far as that goes.
All right. We're going to move on to your musculoskeletal.
Okay.
Any issues with tightness or stiffness in the joints?
No, ma'am. Not that I've noticed.
Any pain in the joints?
No, ma'am.
Any redness, swelling, heat from the joints?
No, ma'am.
Okay. Neurological?
Okay.
Any issues concentrating?
No, ma'am.
Any depression, anxiety?
No, ma'am.
Any paralysis or weakness?
No, ma'am.
Any issues with syncope
No, ma'am.
or any dizziness?
No dizziness.
All right, we're going to move on to your mental health.
Okay.
Depression, mood changes,
No, ma'am.
irritability,
No, ma'am.
sleep disturbances,
No, ma'am.
any issues with concentrating?
No, ma'am.
All right. Well, I think I've covered about everything.
Okay.
Thank you so much for your time.
Thank you.